Every day this week, our Breaking the Backlog series has been looking at the pressures facing the NHS this winter and some of the ideas NHS staff have come up with to try to cope. Our health correspondent Mark Norman is here. Hello Mark, we've been, highlighting lots of things, haven't we? Some of the success stories here in the South East, but there's no getting away from the fact that many people have a very different reality. Long waiting lists, overcrowded hospitals, nurses and ambulance workers on strike.
Absolutely right, and more strikes on Monday, of course. I mean, this week we've seen how the NHS is trying to deal with some of those challenges, different ways of working in GP surgeries, urgent response teams in the community, rolling out more virtual wards. And all of that's very nice, but how is that going to make a difference to some of those huge challenges that you talk about? So today I've been interviewing the boss of the NHS in Sussex and saying, you know, as you've let us in this week, what are the key messages you try to get out to us, the patients?
For our communities and our patients, some have been waiting quite some time for their urgent emergency care services and for their planned care services. And we wanted to say, A, we recognise that, but B, we've got really strong and exciting plans to get on top of that.
Is this an element of just tinkering around the edges and not really dealing with the big issues that we all know and we've all heard about so much of in the last few months and years?
What I've heard from people is the demand is really high now, and I'm really clear the way to respond to that is to start to really transform our services. So we're really looking to do three main areas over the next 5 years. One, to have really strong and innovative and vibrant community teams. Really digitise and change the way we deliver health and care, and look at really different workforce solutions for how we handle that.
But the reality is people still come to us time and again. They can't get the GP appointment. They can't get the ambulance response times. The ambulance crews are held up. You know, A&E's rammed. Hospital doctors say to me they can't get patients out the other end. And those are the big issues. What you're doing at the moment is not going to affect those immediately, is it?
So first of all, I recognise for each of those people that have been waiting too long for their ambulance, for those who have been on the back of an ambulance waiting to be admitted into hospital, and for those who are waiting for their planned care procedure or their operation, I recognise that it's challenging for those people. There are tactical things we are doing here and now. So for example, we've agreed really clearly across our system that for the next 3 months we are focusing really hard to have no corridor care in any part of our A&Es across Sussex. That's the first piece. Now there'll be challenges at points as we manage that, but we're working really hard to put the right services in.
But in order to do that, you're going to need the staff, you know, you're going to need the budget. And those are big struggles. You can't just take the staff out of hospitals and bring them into your community services. How are you going to make that work quickly?
So we've got to look at how we handle this situation with really innovative and creative solutions. And actually, I do think there is much more we can be doing if we lean into what communities can offer to really help to manage their conditions better. It's also really important that all of our community do also use services wisely, you know, access them at the right time, but also avail themselves to the many different ways they can therefore get access to care.
There's probably 1,000 patients today in hospital medically fit for discharge. The reality is, if you could get them into social care, you'd free up beds, you'd free up ambulance handover times, which frees up response times, which brings confidence into the system. When you sit round your big table as the Integrated Care Board, is that the #1 challenge?
So yes, today there are too many people in the wrong care setting. But it is important to recognise we have to work really closely with our social care colleagues. The system that we work within is all about how we can partner to respond to the problems that we've all got together, so that we're therefore solving those problems at the same time.
If you could do one thing, money no object, politics no object, to change it quickly, what would you do?
So one thing, I would probably suggest getting as much available workforce into the areas where we have got gaps. So I'd look at social care, I'd look at primary care. If I could do that quickly, that would be the first thing that I would do, because I think the population and community would see an immediate benefit.
Well, thank you very much, and I wish you good luck with the job.
Thank you.
Right, so he wants more staff and more resources.
He does, now, yeah.
There's no magic wand, is there?
No, absolutely not. Clearly staffing is top of his list if politics were not an issue. I took a couple of other things away too. He's clearly got a plan for now, but he talked about a 5-year plan too, and I think, as you said, if it was easy they would have done it. They're thinking it's a much longer term fix. And I think the other interesting bit was he reminded us, the patients, use the service wisely. And I think that's a message we're going to hear repeatedly. But no easy fixes whatsoever. The one thing I've also taken away from the week of filming is the enthusiasm and commitment that you see from frontline staff. You know, they want to do things differently, they want to make a difference, but there's this huge demand, these huge challenges. It's going to be a struggle. We're going to be sitting here again talking about how they're trying to do that.
Demand isn't going away, is it?
It's not.
Thanks very much, Mark.